Glaucoma is a chronic eye condition characterized by increased intraocular pressure, which can lead to damage to the optic nerve and irreversible vision loss, usually starting with peripheral vision. Since it often does not present symptoms in the early stages, early detection through regular ophthalmological examinations is essential. Approximately 80 million people worldwide are affected by glaucoma, and this number is increasing, considering that the disease can occur at any age. Scientific research has been conducted, and an anti-glaucoma shunt with 2 valves has been developed and manufactured at the Nicolae Testemitanu State University of Medicine and Pharmacy in the Republic of Moldova, Department of Ophthalmology, as part of the state project's call for 2020 to 2023. The anti-glaucoma shunt with 2 valves is made from biocompatible medical titanium, consisting of a disc with a diameter of 2.5 mm and a thickness of 1 mm. In this disc, there are 2 cross-shaped channels with a diameter of 0.6 mm. The first channel extends from the front to the back, the second channel is perpendicular to the first, but its ends are closed. Parallel to the first channel, there are 2 additional bilateral channels on the right and left with a diameter of 0.3 mm, which connect to the second channel, the one perpendicular to the first channel. A titanium tube with a diameter of 0.6 mm, bent at a 45-degree angle and measuring 3 to 5 mm in length, is inserted into the first channel. The 2 channels located bilaterally to the first channel are fitted with 2 silicone tubes with an external diameter of 0.3 mm, an internal diameter of 0.2 mm, and a length of 5 to 8 mm. At the end of the titanium tube, the first valve is placed. It opens when the intraocular pressure is less than 22 mm of mercury, allowing the aqueous humor to pass from the anterior chamber of the eye through the titanium tube and into the second channel, which is perpendicular to the first channel. The aqueous humor then exits through the silicone tubes and drains into the Schlemm's canal. When the intraocular pressure rises above 22 mm of mercury, the second valve opens, and the aqueous humor exits through the back of the disc. This valve shunt can be placed in the superior temporal, superior nasal, inferior nasal, or inferior temporal quadrant. The patient is prepared for the procedure under local or general anesthesia, depending on the situation and the surgeon's preferences. The surgeon makes a small incision at the level of the conjunctiva and sclera to create a pocket where the flap will be made. A scleral flap is formed. We open the Schlemm's canal and create an opening in the middle, 2 mm away from the flap, in the anterior chamber of the eye. Then, the valve shunt is placed beneath the flap, on the sclera, and the titanium tube is inserted into the central opening in the anterior chamber, while the bilateral tubes are inserted into the Schlemm's canal. The flap is closed over the shunt with 3 fine sutures. The conjunctival incision is closed with fine sutures, ensuring that the device is well covered and stable. After the procedure, the patient receives postoperative treatment to reduce inflammation and prevent infections. Regular monitoring is recommended to assess intraocular pressure.